Morning folks, so today we're going to be talking about a technique called the butt touch. Essentially you need yourself, your butt facing a wall, and it's going to be pretty close to it. Okay, so there are a few things I want to talk to you about before we actually run through what the technique is. Some people like to think of this as a precursor to the deadlift, so it's really important that we understand what we're doing with our feet, with our hands and with our breathing. Okay, so very much like the spinal breathing, Superman Clark Kent drills that we've done before, we're going to utilize the same movement with our breath with this. So, from our upright position before we take our hips back to meet the wall, we're going to breathe in. So, anterior tilt of the pelvis, so the front of the pelvis tilts down, the tailbone comes out a little, and increases the space in our abdominal cavity, lateral through the ribs, lifting the manubrium up to meet the chin, slight chin tuck as we do that. Once we've done that, we're going to brace, we're going to take the hips back to meet the wall, and then we're going to squeeze the glutes, push the ground away, and as we do so, we're going to transition into the exhalation position. So the glutes being squeezed will help tuck the tailbone under, bring the pubic bone up to meet towards the xiphoid. So we're going to zip up our core. The chin relaxes. So to demonstrate that, we're going to breathe in. Chin comes back, pelvis tilts lateral through the ribs. We're going to brace. We're going to come back, touch the wall. Shush sound is important to engage the pelvic floor. Glutes, feet push the ground away. So, feet, what are they doing? So we've got our tripod. So the ball of the big toe, ball of the little toe, and the heel form our foot tripod. That needs to be engaged with the ground. We want to make sure that our our toes stay engaged with the ground as well. If they're lifting or they're doing funny things, we want to make sure that we get a check on that. If you need help with your foot mechanics, then just drop me a line. I can help you run through some bits and pieces for those. But we want to make sure that the little toe is being screwed into the ground. So if these are my feet, I'm screwing that way. Now my feet aren't moving, it's just my legs that are doing that screw movement. So from the ankles, through the knees, into the hips, to help make sure that our feet are planted in the correct direction, but also help activate that posterior chain what we are working on. Our little fingers and ring fingers, we also need to make sure they're engaged once we start using weight. Same as we did with the thoracic decompression hanging, this is going to help activate our lats, again posterior chain. So we're going to be in this position, we're just going to rotate those round so we've got that full activation from the little finger, ring finger all the way up and into the posterior chain. Okay, so those are the things I wanted to run through. Let's have a look at what the technique looks like. Okay, so side on posture so that I can show you a little bit easier. You want to position your feet an adequate amount of distance apart from the wall. So you see here, it's not actually a whole foot length that I'm out. You want to work within your range of tolerance. Okay, some people will be closer, some people will be a little further away. That's absolutely fine. Work with what is comfortable, doesn't cause pain throughout any of the movement. Okay, so the movement from the side. We start in a neutral position, we've got our foot tripod, we make sure our toes are engaged, little fingers engaged even though we've got no weight. We breathe in, a little bit of an anterior tilt, chin comes in, we take the hips back with a brace position. We come squeeze, push the ground away, zip up. Great, so now you've mastered the movement. We're going to practice that for a number of reps until you get familiar with what the movement entails, what it feels like to twist the legs in so that you're engaging the little toes, what it feels like to engage the little fingers and feel your lats and the whole posterior chain working, pushing the ground away, all that kind of stuff. You want to repeat that so that every single rep feels the best rep you can achieve. Once you've done that, you're ready to take on some weight. Now, I don't like working directly from the floor, so you'll see I've created a little platform with a pot of paint. You can work from the floor or adjust the height accordingly. What you do want to do is make sure that the weight stays as close to your midline. So imagine a plumb line from the top of your head running down the center of your body down towards your ankles. You want to try and keep the weight as close to that as possible. So you'll effectively be running your arms up the front of your legs and into your body. So what does that look like? Okay, so exactly the same. We screw in the legs, we screw in the lats, we breathe in using the spinal breathing technique, so an anterior tip to the pelvis, the chin comes in, we go down with the butt touch, back goes back first, grab the weight, and then and down. Down again. Great. I hope you found those useful. Let me know how you get on.